Is it under your name? The email didn't come from yours, Ralston.
It's, yeah, it is, but it's Ralston GD at Paso, and I did it from, because I can't do it from.
We have an action packed.
Okay, Marcus. Testing.
You like those kids that are separated in school? They're like, oh, I don't put them together.
Good morning, everyone. Thank you for being here. We're starting just a couple of minutes late. I still saw some people just coming in, but at this time, we're going to open up this month's meeting of the El Paso County Board of Health. Start with a board member roll call. General Jack Briggs. Here. Councilmember Dave Donaldson. Dr. Vu.
I'm here.
Doris Ralston.
Here.
Dr. Turbush.
Present.
I believe we have Commissioner Gonzalez online. And I do see at the back of the room, Commissioner Cammie Bremer just walked in the room, so thank you. I'd like to acknowledge, I know we got a big crowd here this morning.
One
Thank
more.
you.
One more.
Oh, I'm sorry. Glant, I'm sorry, Glant, I apologize. Yeah, and Glant is here as well. And again, we do have a big group here this morning. I know we've got at least one elected official in the House. We've got our county coroner in the back of the room. You raise your hand, wave hello. There he is. Yeah. Okay, I assume that everyone has had an opportunity to look over the agenda. Can we get a motion to approve the agenda in a second?
So moved.
Second.
Doris moved that we approve the agenda, and Dr. Turbush seconded that. All in favor of the agenda as presented?
Aye.
Aye.
Aye. Any opposed? No, and that passes. Okay, we're going to move into Board of Health comments. And I'll just kind of go around the room, Glant, since I forgot you. I'm going to start with you first. Do you have any comments for the board?
Not at this time.
Okay, thank you. Dr. Turbush.
Very quickly, we got an email. We, the Board of Health, got an email about participation in actually a required continuing education called Leadership in Action. And this is part of a piece of legislation that was passed at the state level, oh gosh, a couple of years ago, for helping to bring boards of health up to speed. And the previous one that we did last year was on emergency preparedness and participation in the NIMS system and ICS and so on. I thought it was quite good. This one looks interesting. It's on June 7th, and to participate, you have to sign up. That's all.
Thank you, Dr. Turbush. Doris, any comments?
No comments.
Dr. Vu?
No comment, thank you.
Councilmember Donaldson?
No comments.
And Commissioner Bremer?
I will break the trend here. Yes, so I just wanted to congratulate our team, although we don't know kind of final status. I know that we had several CCI or several nominated awards at the NACO conference that are out of our health department and out of the great work that they've done building collaborative partnerships. So once again, our health department will be honored at the July conference of the National Association of Counties for just being a groundbreaking leader in work, and I think we're waiting with bated breath to see exactly where we fall, but they were nominated as honorees regardless, and congratulations. And I know that each application for that takes a lot of staff work too, but thankfully this department is in a pattern of kind of always recording the outcomes anyway, and so glad that we had those ready to nominate, and good luck. Congratulations.
General Biggs, any comments?
No, sir.
Okay, I'm going to go to Commissioner Gonzalez online, if he can hear us. Are you with us?
Those on Teams can't hear, but Andrew is working on it, and we'll get back to.
Okay, we'll get back to Commissioner Gonzalez. I've got a couple things to mention myself. The first thing that I would like to mention is that Susan has applied for and been selected to make a presentation at the National Association of Local Boards of Health this summer. It's the end of July, beginning of August. And she has graciously included me in that we will make a presentation to that National Association. We're excited about that. We'd love to tell you details about the presentation, but we haven't really put it all together yet, so we're still working on it. But it's an honor to be able to do that, to be able to speak to other boards of health leaders across the country and share some experiences that we have learned here in Colorado Springs. Susan, you want to comment on that?
Sure, and I'd like to thank our development officer, Carolyn Gary, who put the bulk of the submission together, which we were selected. And the title is, although we're not going to go over details of this, it is Reflect, Restore, Reframe, Advancing the Agency Benefits the Whole Community. And this is a topic that is near and dear to leadership of this agency and throughout. And so I look forward to presenting with you as the president of our Board of Health. And also, I believe that Commissioner Bremer is going to join us as well. And I would also invite any other board members to attend the conference. I believe it's July 31st through maybe August 2nd in
Tacoma, Washington.
Tacoma, Washington.
Yeah.
And if you'd like more details, we can send that out. But it is a good time, it's a good conference to connect with Board of Health members throughout the nation. And this is the association in which you all are part of, the National Association of Local Boards of Health.
Okay, and one other comment that I'd like to make to the board. I had the pleasure last week of having coffee with another one of our board members, General Jack Briggs, and one of the things that we discussed and what I really brought up to him is that something I'd like is a tour of the Springs Rescue Mission. And I think that would be beneficial. I know it would be beneficial to me. I have in my mind an idea of what the Springs Rescue Mission does, but I don't think I have a full picture of everything that they do for a very important segment of our community. And so General Briggs made that offer to me to get a tour and also mentioned that it'd be great if anyone else on the board, if you haven't had a tour of the Springs Rescue Mission, I spoke with, or via email with Paula, Susan's assistant, and she would be happy to coordinate that kind of a tour. So if you're interested, please let me know after the meeting. We would love to get as many board members as possible to get that kind of a familiarization. And then as we were talking, I started thinking about other community resources that we as a board often refer to in our meetings, that we talk about, that some of our constituents in El Paso County use frequently. And I think that there's an opportunity for us to learn more about our community by visiting some of these places, getting tours of them. One fascinating tour that I was able to get when I was the fire chief was the jail here in El Paso County. It's the largest jail in the state of Colorado, and I learned a great deal about and our new sheriff, Joe Roybal. He gave the tour, and he didn't refer to anybody as inmates. He referred to them as our citizens, because really it's a small city that they have. He named what size of city that would be in the state of Colorado, and with that many people there every single day, it was just a fascinating tour to find out everything that they do. And so I'm going to bring those kinds of ideas forward. If other members of the board have ideas of places that we can get a tour of, or if you've been on a tour that we can learn some things about our community, please let me know. And we won't stack them up on the calendar. We'll spread them out so that we don't try to overburden anybody's calendar with these kinds of tours. But I think it would be beneficial for all of us to learn what we can about our community. I did Dr. Keller. Okay, and with that, I think we have concluded our board member comments. We're going on to an approval of the minutes. We'll need a vote on that, so motion and a second.
A motion to submit the Board of Health minutes for April 26, 2023 as written.
Thank you. Okay, that's General Briggs gave the motion and Glant has seconded. All in favor of accepting the minutes as written? Aye. Any opposed? Okay, and they passed unanimously. Moving on to public comment. I was notified earlier we didn't have anyone who'd signed up, but several people have come into the room since then. And so I want to make that opportunity available. If there's anything that our public would like to comment on, now would be your opportunity. And nobody's making direct eye contact, so I take that as a no. Okay, let's go to finance and budget.
And we have Samantha online.
Okay, is she able to speak to us online, Samantha? I think we're working on the technology right now. Okay, we're going to table that for just a moment, and we'll come back to finance and budget later on in the meeting. We've got some people present for some presentations on contracts, renewal of contracts. And Susan, do you want to introduce these folks as they come up?
Sure. We'll move on to contracts, and then we'll circle back with our budget manager, Sam, online, but we'll go ahead and start the presentations with our contract renewals. First, we'll start with Christy Durbin, who is one of our public health nurses, and she is an immunization program manager, and this is for the immunization core services.
Good morning. So I'm just going to give you a brief overview of what the immunization program does. So we vaccinate children and adults of all ages. We provide international travel health education, which includes food and water precautions, insect precautions, and tailored vaccine recommendations for those who are traveling. We also respond to vaccine-preventable disease outbreaks, including hepatitis A, Mpox, and most recently invasive pneumococcal disease. We do a lot of work in our community with partners to increase vaccination rates and decrease barriers to care. We talked a little bit about our mobile immunization outreach team a couple months ago, and we are able to serve those with and without insurance. And then next slide, or I guess 2 slides from here. Somebody go to the next slide, please. And then one more. Okay, so our immunization core contract, we have 13.6 full-time employees and 7 part-time employees. In 2022, we administered over 10,000 vaccines and participated in over 80 outreach events. And during 2022, we were still working through some staffing challenges, including recruitment and retention, especially with nurses. So still kind of working at limited capacity. We still have a few vacant positions open. And then our immunization core funding runs from July 1st of this year to June 30th of 2024. This is an annual contract with state and federal funds. There's no indirect. This contract is a little over $616,000, which is an increase of over $54,000 from last year. So I'm happy to take any questions about that.
Any questions from the board? Go ahead.
Yeah, thanks for the presentation. Are there income levels, or can you just explain the financial side of it to me? These aren't these immunizations which public health provides. They're not only for Medicaid recipients or people who can't afford their
Correct.
private physician. How does that work?
So we have 6 different vaccine funding sources. So we do receive vaccine from the state and the federal government to serve those who have Medicaid or no insurance. But we also privately purchase vaccine to serve those who have private insurance, and we're able to bill insurance, and that's one of our revenue sources is reimbursement from insurance companies.
So a citizen of Colorado Springs or the county who needs whatever, pick your shot, hepatitis A, could come here rather
Yes.
than book an appointment with their. Is it walk-in, or do they have to call? How does it
So
work?
right now we have appointments, but we do our best to try and serve everyone. But sometimes it's hard to get in with your doctor, or maybe you're not set up with a primary care physician, and so we're kind of able to be that safety net of people can come in and get their vaccine quickly and efficiently.
Is there anything common vaccines which we don't public health doesn't provide?
We provide every vaccine basically except anthrax, but only the military does that. So.
Yeah, I've had that one.
Yeah, I bet you have.
That's very interesting. I'll pass that on at City Council. Thank you. Thanks a lot.
And Mr. Donaldson, I also wanted to add too, we have a travel clinic which is heavily used, and sometimes providers do not carry the types of vaccines that we do, and so we're a resource. And the effort to, the ability to invoice or take private insurance is relatively new. That hasn't always been the case, but we try to ensure that we're serving the entire population, and also trying to, at a minimum, recover our costs. And so that is something that is new within the last few years.
Is there a travel fee for the mobile team?
So the mobile team that goes out, we don't charge a fee. We just try and be efficient with that, and that going where the need is, where there's a large group of people that are in need of a vaccine, but we don't charge to send out the mobile team.
Clarence, I don't think your microphone's on.
Red, but it's on.
Yeah.
So for my older population, would you come to Tri-Lakes and get the flu vaccine?
Sure, yeah.
And I'd say, Mayor Glant, that for the mobile clinic, we try to address vulnerable populations, such as senior citizens that might have access barriers to coming to our agency. And then we also try to be efficient and flexible when there are disease outbreaks and go into different communities. So that has allowed us the ability, with the vastness of El Paso County and the landscape, to cover, and trying to immunize appropriately and efficiently. And
Commissioner Bremer.
I just wanted to clarify too, I heard our director talk about the travel clinic, and then I heard discussion about the mobile clinic. Those are actually 2 different offerings,
Yes.
correct? So the travel clinic is for those who have international travel plans
Yes.
to areas where they need specific vaccinations. And I think what our director was saying was that we carry many of those that your average PCP office will not be able to provide. And then in addition, we'll also be able to plan those mobile vaccination clinics to high-need areas.
Yes, that's correct. Yeah. So if somebody's like going to Thailand or they're going to Peru or something like that, we're able to vaccinate them appropriately for that travel and educate them so they can travel safely, have a great time, and come back. And then our mobile team brings vaccine to areas of our community.
And citizens can just pay cash, is that right? They don't have to have insurance.
Correct. Yes.
Christy, I just want to say thank you to you and your team for providing this important service. Thank you.
Thank you.
Thank you, Christy. We'll move on to the next contract unless someone tells me that Samantha is available online. So next up is our Nurse Family Partnership contract, and Kara Hamby with NFP, as we call it, is our program manager to present.
Good morning. My name is Kara. I am the program manager for Nurse Family Partnership, and I'm going to just give you a quick overview of this program. Our contract is up for renewal for the 22nd time at this county. So we are a nationally recognized evidence-based program that serves first-time low-income families from pregnancy through their child's second birthday. We provide registered nurses who develop a long-term relationship with these clients. So in theory, they could be visiting every 2 weeks for 2.5 years with families. We have key goals of improving pregnancy outcomes, which we measure through our number of full-time deliveries, healthy birth weights, smoking cessation, and prenatal nutrition. We also improve child health and development by screening for physical growth and developmental milestones. And we improve economic self-sufficiency of our families, including supporting goal setting around education, employment, and budgeting. And then in 2022, we have a few things that we're just really proud of. We have a significant number of amount of data that is collected for this program. It's national, and we have 40 years of data. In 2022, our premature birth rate was 7.6%, which is significant given the number and risk factors for our clients. We also had 96% of clients who initiated breastfeeding at birth. 100% of the children who were enrolled were fully vaccinated by 24 months, which in our community we know is a significant issue, especially given COVID rates that have lowered for vaccinations. And we saw a 14% increase in full-time employment for our clients from the time they enrolled until the time they finished our program. Last year, we conducted 2,314 home visits with our clients. We had 7 nurses. We are funded for 8 full-time registered nurses. We have had a bit of a challenge recruiting and retaining registered nurses. Next slide, please. A little bit about our funding. We are authorized by the Colorado Revised Statute Nurse Home Visitor Act of 2000. We are funded through tobacco litigation money. This year, we saw a pretty significant increase in our budget due to COLA, and in order to help retain and attract qualified nurses, we have an indirect rate of 23.06%, and we are funded for 10 full-time employees, a program assistant, myself, this is the program manager, and 8 registered nurses, and we have 2 vacant positions currently. Are there any questions?
General Briggs.
Yes, thank you. Can you tell me just rough numbers of how many clients you actually have?
Sure, we are funded for 200 clients at any given time. There's also an NFP site at the University of Colorado, Colorado Springs, and they are funded for 80. So altogether, that's how many we serve at a time.
Okay, and then are you at the max? You're at 200 all the time?
We
With a waiting list or something
we
like
do
that?
have a waiting list. We also have staffing issues. So we are, each nurse is bound by a certain number of clients they can carry. So we are down 2 nurses. So we would be down that number of clients.
So how many clients is that?
25 per nurse. So we are around 160 currently.
Okay, thank you. That was what it was afterwards. Okay, so I do have, can you go back one slide, please? To the accomplishments. So when you say 100% of children, so that's the 160 kids, right? I've got that number right?
Yes.
Okay, so 100% of those 160 kids, by the time they're 2, have all their vaccinations.
That is correct. So for children who stay in the program for the entirety of the program. So we have a very transient population. So we serve a lot of military families. So they may leave after a year.
Okay.
So this is for anyone who has data recorded at 24 months.
Okay. And you mentioned something about COVID. Can you explain to me how that folds into that 100% of children were vaccinated?
Sure. During COVID, we saw a significant decrease in the number of children receiving routine vaccinations
Okay.
because of a decrease in well-child visits.
But it's not 100% got the COVID vaccination.
No, not unrelated to COVID. COVID
I
is
see.
not
Okay.
included.
I was
This
trying to
is-
understand that because that seems,
Yes, just
you know, like
routine
something.
childhood
Okay,
vaccinations.
got it. Okay.
Mhm.
Thank you.
Yeah.
Any other questions? Seeing none, thank you.
Thank you.
Thank you, Kara. We'll move on to Becca Barnhart with a substance misuse prevention contract. It's formally titled Communities That Care.
Ooh, that is on. Okay. Hi, I've seen you all before. It's nice to see you again. I'm Becca Barnhart. I'm the Youth Substance Use Prevention Planner with El Paso County Public Health, and my role is to lead Fountain Valley Communities That Care, which is a community-led coalition that works to reduce youth substance use in Fountain, Fort Carson, Widefield, and Security, which is collectively known as the Fountain Valley. In 2016, El Paso County Public Health received grant funding from the Colorado Department of Public Health and Environment to implement the Communities That Care program, specifically that prevention model, in one of our communities that demonstrated readiness to implement this program. The CTC prevention model is a 5-phase change process that uses evidence-based approaches to promote healthy youth development, improve youth outcomes, and reduce problem behaviors. For example, to prevent youth substance use, FVCTC focuses efforts on increasing safe spaces for young people in our community. Having access to safe spaces in the community is associated with lower risk of substance use due to an increased sense of connection to their community in which they reside, which, as you can see, directly correlates to our shared mission and vision, specifically our vision, which is to have a safe, inclusive, and connected community for all youth and families within the Fountain Valley. With the collaborative help of all involved in FVCTC over the past 6 years, the Fountain Valley has enhanced its ability and capacity to make sustainable changes and create opportunities to reduce youth substance use and other unhealthy behaviors. The work of FVCTC has benefited from 3 funding sources. Oh, excuse me, can you change the slide? There we go. Has benefited from 3 funding sources. The initial CTC funding has allowed us to create a really solid foundation through the community collaboration to address the issue of substance misuse and creating, again, a safer community for youth and families. Drug-free communities build upon this foundation by providing funding to enhance our community's ability to address 2 specific substances. Those are marijuana and opioids, and also focusing on fentanyl as well. The Colorado Trust Grant continues to build on that by allowing us to fund programmatic needs that were identified by the community and carry out action items created by the coalition that required funding. Each funding source works in conjunction with one another and elevates our level of success in effectively preventing youth substance use in the Fountain Valley. Sorry. And then the next slide. So as you can see, we're up for renewal. I didn't say that in the beginning. Our first grant cycle was 2016 through 2021. And then where we're at right now is 2023, which is within the second grant cycle. So once that ends in the 10 years, we will not have this funding anymore. But we're up for renewal for the 2023-2024 fiscal year. Our funding source is Colorado Department of Public Health and Environment, and their fiscal year is July 1st through June 30th. The amount has not changed from the past few previous years, so we're still at $290,375. Indirect rate is a negotiated rate at 23.06%, and this grant funds 3.5 full-time employees. And then one more slide. FVCTC Coalition has had numerous accomplishments to date, including efforts that work to build community capacity, strengthen community collaboration, increase youth engagement and empowerment, and of course, prevent substance use. Since our DFC funding began in late 2021, we have collected over 430 pounds of unused and expired prescription medications through our drug take-back days in an effort to safely dispose of prescription medications. We also distributed 300 prescription medication lock boxes to families in the Fountain Valley to encourage safe storage of medications. Both initiatives were an effort to prevent opioid addiction from ever beginning in the home and prevent unintentional poisonings. I also want to note that our Teen Action Board, you can see we have a youth engagement category. Our Teen Action Board also has numerous accomplishments to date, including receiving national recognition at the National Association of Counties Conference for their work amplifying youth voice in the community in 2021. Their input and their hard work is valuable to not only the coalition, but also to our community. They will be presenting to you all at a later date as well, so you can hear more about their work and why they're involved in community work. Other notable accomplishments are listed on the slide. Honestly, we at FECTC are just really proud of what we've been able to do in the community, and we really look forward to building on our successes. Thank you.
Questions from the board?
I do have a couple of questions. So can you just clarify that the Teen Action Board is going to come speak to us?
They are. We're hoping for August. Our biggest struggle is that they are located, a lot of them are in Fountain, and then, of course, the Whitefield area. They're very young. We actually have a pretty young Teen Action Board. They're mostly in middle school right now.
Okay.
So they rely on their parents, and it's
Sure.
it's a bit of a drive.
Okay,
to
I mean,
get
it'd be
here.
fascinating to just ask, without putting them on the spot.
Yeah.
I get it. But to just get some feedback from them about impact of maybe the education, what they see in classes. I see we have some young folks here today.
Yes.
That, are they seeing any difference when this education happens among their classmates and peers in terms of knowledge, use, access, those sorts of things, to not just prescription medication,
Yeah.
but marijuana and other things.
Yeah.
So is that the intent of that conversation?
I mean, I did ask them when we were going through, because we were going to present last month, we asked them to talk about, why did you get involved in community work? Why is that something that you're passionate about? What is an issue that you notice kind of within your own community that you feel passionate about addressing? And then kind of what they've really enjoyed about being on the Teen Action Board. So I did kind of present to them, what are some things that you've noticed? But I think that would be a good question that I can also prepare for them now.
That would be
Is what have
wonderful.
you noticed as a result of maybe your efforts to your
Right.
peers?
I know it'd be super scary to have to talk, but I promise we'll be super nice.
I appreciate that. I told them you would be.
We will be, I promise.
Okay.
I have a second question.
Yes.
And it may not be yours to answer, and it may not be to answer now, but I'll just ask it. We are concerned about a trend. We talked about tranq last time. We're also talking about now fentanyl in marijuana. And I don't know if we have any data. I see Dr. Kelly in the back there. I'm not going to put him on the spot either. But it would be interesting to understand what the changing dynamics of the supply of drugs out in the community, as those two things in particular start to gain interest. And it may be just because that's what the media is talking about, and it's not a factor in El Paso County. On the other hand, it might be, which are both incredibly dangerous. So we just I guess I'm looking at you.
Yes, and so one of the to-dos for our Board of Health is to have a presentation on the opioid dashboard that we're working on. And we also have a collaborative with other county leaders such as District Attorney Michael Allen, Dr. Kelly, Dr. Emily Russell. Sheriff Roybal. And so we'll bring that forward and dive in deep there. I mean, the requests that we have today will address more in-depth data as it relates to suicide prevention. And I did want to note that we always talk about impacts as it relates to the work that we're doing. And so as we prep with the kids, we will have discussion and preparation on that. And I'd like to propose, if we are at a place with renovations for our Public Health South building, I would like to hold the meeting at Public Health South in August. It may not be fully renovated, but I think that's a way that we could accommodate some of the kids. And the kids were looking so forward to presenting last time. And we do have students working against tobacco, and they are in the audience now. And so we do have an opportunity to talk about prevention of tobacco, because that's a drug too, nicotine. And so we'll have an opportunity, and I know that they'll do a great job.
And I know, Susan, you and I spoke about this a couple weeks ago when we met, but in Tri-Lakes, it's interesting to me, in both of our high schools, vape use is rampant. Literally, like half the kids.
Yeah.
And so our program manager with the Tobacco Education Prevention Partnership, which is next up with the contract, we'll talk about that, because they focus a lot on vape use and nicotine. And, fun fact for the state of Colorado, if this is still true, there is no standardization of nicotine on the product labels too. So that is something that they're working to to educate about, because some kids think that, oh, it's just flavor, there's no nicotine in there.
There is.
You-
And you can,
exactly.
and the DAP, they can put
Yeah.
weed in there. I saw a vape the other day, okay? I saw a vape the other day that looked like a highlighter. You would never know it wasn't a highlighter. The kids have vapes that are hidden in their backpacks
Oh,
that
yeah,
look
or in
like,
their sleeves.
yeah,
Yeah.
like that. That's what the vape looks like, just like that.
Yeah, even tinier.
Yeah, but I mean, it looks like you don't know. Like it's so, I mean, it's everywhere.
Any more questions for Becca?
Chief Colas, can I? Becca, I also want to thank you and your team for this important work. I've been trying to organize my mind over the last 2 minutes. I don't think I can organize my mind, so I'm just going to speak if that's okay. So, substance use and misuse among children. So it's so important that we focus on this. And even though I really don't know the data, I have heard of indirect data, but I really think that the time that children spend with their parents does affect in a positive way to decrease substance use and misuse and mental health issues in children. So I would just want to encourage parents in our community to fight for your time away from work, away from other things, away from other priorities, to spend with your children. There's a concept in my mind of quality time, but in my mind, anytime you spend with your children is better than no time. So fight for that time. I also see that we have a lot of children, a lot of youth, a lot of teenagers here. You guys, your parents need to spend time with you. You fight for that time. And you spend time with your parents. Even if you don't like them, as much as possible, spend time with your parents. You will not regret it when you grow up. So spend time with your parents, and parents fight for that time to spend with your children. Thank you.
Thank you for saying that. We are, now that we're fully staffed as of last week, one of the first initiatives that the coalition has discussed is creating a parent board so that we could start talking to parents and educating them about how to talk to your kids about substance use. Because that's one of the best prevention methods is having a trusted adult directly talk to you about it and address it. It is actually rather effective to have those conversations, especially as they enter middle school. So I love that. Thank you.
And Becca, thank you for that. And thank you for that last statement about a trusted adult as well. We know that not every child out there that you interface with has parents at home that they can interface with, but maybe their friends have parents that are involved and that are caring, and they can still spread that positive message when they have other kids over for dinner or to play with or anything like that.
Yes,
So
thank you so much.
Thank you, Becca. And Daisha Hudson, who is the program manager with our Tobacco Education Prevention Partnership. We have a contract up, and then also we have SWAT here, which are the students working against tobacco in numerous different school districts in El Paso County.
Yes. Good morning. I'm Daisha Hudson. I'm the program manager for the Tobacco Education and Prevention Partnership. Really excited to have some of our youth here that we've been working with. And so hopefully I can get through this so we can get to them. But our program is a grant-funded program, and we work with community partners to address these three main overarching goal areas, which is to help adults and youth quit tobacco, prevent youth from starting tobacco, and then decrease secondhand smoke exposure. And we work on a number of different strategies within the community and with our community partners to address these goals. Our contract is, it runs July 1 through June 30. Our contract amount is $791,153, which is a 4.1% increase over the previous year to cover the cost of living increases and to attract and retain qualified staff. We are able to charge the full indirect, and our funding source is the Colorado Department of Public Health and Environment. And I am pleased to say that we just recently hired for our vacant position, and we are fully staffed with 5.5 FTE. So as I mentioned, we work on a number of different strategies to reach reach our goals, those three main goals. And that's through our community services, through collaborating with schools and young people to strengthen their tobacco-free school policies, and to engage with youth. We also work with our health and social service partners in the community to ensure that they have the training that they need, that we're recognizing tobacco use as a chronic condition, and that we are asking people, no matter where they go to seek services, if they use tobacco, if they're interested in quitting, and then providing them with a free resource to help them quit. We assist businesses, workplaces, multi-unit housing properties in adopting smoke-free policies to limit exposure to secondhand smoke. We see that a lot in our multi-unit housing properties where the policies just have not kept up, and we got smoke seeping in through vents and things like that, and so people are still exposed to secondhand smoke in our community. And then lastly, a lot of education outreach efforts to educate the community about new and emerging products, about vaping in schools, about cessation resources, all the things that are free to our community to help them either never start or to quit. You know, we've heard a lot over the last several years, like, why are we still talking about tobacco? Haven't we not solved that problem? Well, I think we've already established that we do still have a problem, especially among youth and with vaping. Tobacco, unfortunately, is still the leading cause of preventable death in the United States. We have almost 500,000 people dying every year from using the product as it's intended. 5,100 people in Colorado alone lose their lives to tobacco. And unfortunately, we still have about 15% of adults using cigarettes. That number has been slowly declining, but it's been very challenging to reach that last 15%. Those are people that are disproportionately impacted by tobacco, our low income, so low SES population, minority populations, the LGBT population, those subgroups in our population are disproportionately impacted by tobacco, and they're actually targeted by the industry. And so having a really hard time making a greater impact with those segments of the population. Another reason we're still talking about tobacco is because we all pay for tobacco use, whether you use the product or not. So whether that's you're using it and it's impacting your health, it's costing you your health, or we're paying increased state and federal tax dollars to pay for healthcare services that people aren't able to afford because of their tobacco use. And then we've got new products becoming available faster than they can be regulated, which is exactly what we've seen with the vaping epidemic. You know, it was in 2017 that we learned that 44% of our kids in El Paso County had at least tried a vape. And that was super concerning at that time, and we were so thankful to have that information. And then in 2019, that number had increased just slightly to 46%. So you're right on target that about half of the kids are at least experimenting with the product. And I also have an incoming 8th grader, so I wish he could hear your message to spend time with me. Because that is so important. But yeah, it's taken us a long time to, one, identify that we have an issue, and then keep up with the regulation to match these products that are coming out faster than we know what to do. So all that kind of sounds doom and gloom, but there is good news. In 2019, 26.1% of students in El Paso County, this is El Paso County Healthy Kids Colorado survey data, 26.1% students reported vaping in the last 30 days. So that's different than the ever tried. They'd reported using it in the last 30 days. And while we didn't get El Paso County data, Healthy Kids Colorado survey data in 2021, we do have Colorado data. And the data showed that 16.1% of students reported vaping in the last 30 days. So that's a 10% decrease. And we generally do follow rather closely the trends of the state. And so I think it's safe to say that we are trending downward, even though we don't have that local data. But one thing that we do have that I feel is very promising, and it's part of our key accomplishments, and I really feel like this is the best we could hope for, and I really feel like it's reflective of what our team does here in the county. In 2017, only not even half of students believe that vaping was harmful. So that's a problem. By 2019, after some very targeted outreach, numerous presentations to schools, working with our school partners, we do this every year, that number increased to 70.5, which is huge. That's really what we need. We need kids to believe that this is a dangerous product. But compared to 85% believing that smoking is bad, we clearly still have some work to do. We need to address those myths and misconceptions about vaping in our community. But that is promising. I feel like that is trending in the right direction. People are starting to realize that this isn't safe. And so one of the other key accomplishments that I feel has really impacted these numbers trending down, risk perception trending upward, is the partnership with youth and schools. So each year we collaborate with schools to strengthen and communicate their tobacco-free policies. And so I don't want to take away from their presentations, but some of the main key accomplishments is the youth engagement, obviously. We've provided over 150 plus free tobacco-free school signage, like metal, nice signs to schools, so that anyone who's coming and going knows that they're entering and leaving a tobacco-free campus. We've been able to help work with schools to implement tobacco education and cessation resources within their disciplinary structure through a free program that you'll hear about. And then obviously an increase in trust in adults. We've touched on that today. And I have a slide about that as well, but that's, you know, the adults that are working with these young people, they're trusted adults. Parents are trusted adults. Coaches, it could be your band teacher, it could be a counselor. Every kid needs someone that they can confide in and trust. They need multiple people that they can confide in and trust in. And then we've been able to increase awareness of the dangers of tobacco vaping and nicotine use as seen in the numbers.
I have a question actually
Yeah.
about vaping. We're actually dealing with this with one of my son's friends who chooses not to follow his mother's rules, so he's moved in with us.
Okay.
What he's doing to try to get off the vape is he's substituting with Zins, the 6 milligram Zins. But if the kid's taking 6 of those 5 of those 6 milligram Zins, that's still 30 milligrams a day of nicotine. So what are some other options in encouraging a 16-year-old to get off of vape that doesn't include the Zins, gum chewing? We've tried all of those things.
Okay. Yeah, so obviously the goal is for them not to be using any form of nicotine.
Correct.
Nicotine is especially dangerous for the developing brain, and our brains aren't developed till 25. So I do think that is concerning. There is a free resource. It's called My Life, My Quit.
Okay.
And so you've probably heard of the Colorado Quit Line, which is a free resource that we offer to adults. They can call, they get set up with a coach, so they get counseling, they get set up with free nicotine replacement therapy in the form of gum, lozenges, patches. That's for adults. We have a program in the state of Colorado, it's called My Life, My Quit, which is like an offshoot of the Quit Line.
And it's for kids?
And it's for 12 to 17 years old. So it's designed for them and to work with them on whatever is triggering them. So, you know, and it kind of has all the components to help someone quit, like that counseling piece. They can do it through their phone. And so I would definitely recommend getting them set up with that as a starting place. And then they are, you know, totally equipped to help beyond that individual cessation.
Would I be able to set him up with that since he's not my child, or would I need his mother involved?
They don't have to have permission from a parent
Okay.
to use it. Yep. And it's confidential. Any other questions before we jump into the youth presentation?
I don't have a question, just a comment that we talk a lot about vaping and tobacco smoking and secondary smoke, and but chewing tobacco and dipping is a problem, maybe more in our rural communities of El Paso County, but it still remains a problem, and a lot of kids go right into it, following after parents or whatever. It's less detectable,
Yes.
Yes.
because they're not making a big cloud around them every time they're using it. So that's something else we all need to be aware of.
Yes, thank you for bringing that up. And that definitely is still an issue. It's not as prevalent, but definitely in, certain areas, certain industries, where we see that more. So, yes, thank you.
Okay, thank you.
So before I hand it over, just wanted to give a brief overview of positive youth development. And I think as you've seen through, Becca's presentation, my presentation, and you'll see with the kids that all of our work is grounded in this framework of positive youth development. And I put Community Health Promotion Division. I think almost all of our programs are working with youth in some way and utilizing this framework. And it's really to develop skills, provide opportunities to youth with these 5 principles in mind. So making sure that it's strength-based, that we're, providing opportunities to help them learn new skills and practice those skills that they've learned. It's inclusive, making sure that we have shared decision-making, that we're not making decisions about kids without involving kids. They know what they need more than anyone. And again, seeing youth as partners, making sure that it's collaborative and making sure that it's meaningful. What are they getting out of it? And then sustainable, looking for, long-term planning and evaluation to make sure that we're not just coming in, working with kids, and then, leaving them high and dry without next steps or a way to stay involved. And so just wanted to give you that bit about the framework before I hand it over to Lene Nota, who is a prevention and policy specialist on the Tobacco Education and Prevention Partnership team. And she's just going to give you a brief overview of what you'll be hearing from the students. Thank you.
Good morning, everyone. Thank you for having me here today. My name is Lene Nota, and I am a prevention and policy specialist with the Tobacco Education Prevention Partnership Program. I have had the honor of working with 12 schools this past school year, and I am honored to have 2 of them here with us today. So the primary goal of working with our schools and our youth is to engage the school community and provide education. We also work with them on developing a strong, comprehensive tobacco-free schools policy. These comprehensive tobacco-free school policies include 3 components that we really like to cover and, assist them on. The first one is going to be alternatives to suspension, such as second chance. We advocate for alternatives to suspension because we do not want our students to lose out on the instruction time. They also will be sent home to repeat their actions, and so they're not essentially getting anything out of it. So we advocate for Second Chance, which is a free tool that the schools can use. And so through this program, it touches on the health risks of using tobacco, touches on the health effects that it has on the youth. And so we really strive to get all of our schools signed up with this program. We also want the schools to provide effective communication, and by this we want the community to understand that when they enter a school campus, they are on a tobacco-free campus. And so to implement this strategy, we have the schools update their signage. So at the beginning of the school year, they went through a checklist, and we were able to provide them signs as they needed. The students have also been able to create posters. We've also provided posters, and so they've been able to hang those and present those in their schools. We also asked them to host different type of events just to bring awareness around the issue. Peer-to-peer, is a little bit different from us adults presenting to the students, and so having the students collaborate with one another can make a positive impact. We want the schools to provide tobacco education and cessation resources, and so by this we, want that peer-to-peer contact. They host events, and some of our schools will be touching on the events that they have hosted, involving the whole school. and also using that second chance as a resource to provide cessation and education for school staff who, want to help these students quit or who may have tried and, don't want to further using tobacco. To the right is a facilitator resource guide, and so this is something we give to the schools. In this guide, we include alternative to suspension resources. We also include communication tools, the policy and signage checklist. We provide tips on how to recruit and engage students for the Students Working Against Tobacco group, and all the necessary tools needed to create a strong, comprehensive tobacco-free schools policy. So I would now like to thank two of our schools, Fox Meadow Middle School and Manitou Middle School, for being here with us today. And I'd like to welcome up Fox Middle School and Kristen Boyke and her SWAT group.
Good morning. I'm gonna try to keep this short. My name's Ayla Rankin, Ella French, Fabian Morin.
Could you step a little closer? Thank you.
My name's Ayla Rankin. That's Ella French, Fabian Morin, and then Miss Boyke. We were trying to stop students against tobacco. We provided an escape room for our advisory, which every student has, and it was basically a puzzle to get all the kids to have more information about tobacco and how, it's for everything, like smoking and everything like that. And it's basically to give them information about it and how they stop to do this. The reason why I'm a part of SWAT is because I don't want younger kids to try. And I don't want more kids to be influenced by tobacco and more things like that. And it's affecting us.
Mm-hmm.
Any questions?
I have a comment. You're all going to talk. Great.
We have part two.
Keep going.
Hello, I am Fabian Moran. I am also part of SWAT, and I'm here to talk about one of the community nights we held. It had a part of student prevention and tobacco awareness. There's a part of it. We had 2 sets of lungs that included a healthy pair of lungs and a pair of lungs that was affected by heavy smoking and vaping. I think by presenting that in our community night, I think we rose awareness in our students to see not only the mental but health effects of vaping and smoking and just using tobacco in general.
Thank you.
And I get to talk to you about our second chance or our alternative to suspension. So rather than sending a student who was caught with a vape or caught actually smoking, we had them come usually back in my office in the counseling center, and they worked on this program online. So it gave them information about what's in cigarettes, what's in vapes, so that they had a better understanding of what actually was happening in their bodies. So from the time we implemented it in October to last week, we've had about 30 of our students go through the program, and we've only had about 5 students who have been caught a second time. So part of that is providing resources to the families when we call to notify their parents that they have been caught with a vape. And so they can start working on whatever needs to happen at home. Some of our families are smokers. So as a family, they've gone through some of the programs and used some of the resources. So it's more than just us punishing the student. They are learning from the program. And they forgot to tell you one of their favorite things to do was make buttons this year. So they made buttons for everybody, so they're going to pass those out. So, you guys can... All right, and now we will take questions.
Go ahead.
Thank you very much, and you guys did a great job. Fabian, Fabian, I want to mention something to you. So when I was in middle school, we had a demonstration of what smoke does to a lung, and I still remember it, right? So what you're doing has a lifetime worth of impact. So I congratulate you, and I'm very proud of all of you for getting up here because it's kind of scary, right? But this is really good stuff, so thank you.
Go ahead.
And I also have a question for Fabian. Fabian, what was the difference in those two sets of lungs, the ones that didn't smoke and the ones that smoked? What do they look like?
Well, one was like, it showed a healthy, normal pair of lungs. One you would see in a non-smoker.
Yep.
And like a sort of black pair of lungs that were affected by smoking.
Mm-hmm.
You could see the defects, the dangers of what they can do to your lungs.
So it was black and nasty looking? Yeah, like dirty socks or something? Yep, that's right. That's exactly right. And I want to thank all three of you that were up here for doing the right thing, right? You guys are trying to help your other students at school. You're really doing a great thing, and it takes some courage to be the one to kind of say trying to help them out and tell them what the right thing is. Not because for some crazy idea, but because of those black lungs. And people who smoke, if you smoke for years, when they wake up in the morning, they just cough because their body's trying to get rid of all that gunk that's in their lungs. And so thank you for what you're doing and for having the, for caring and having the courage to do it. So thank you.
That was a great presentation by Fox Meadow Middle School. I would now like to welcome up Manitou Middle School, Janie Anderson, who runs the SWAT program there.
Good morning, everybody. This is only 4 out of 17, or no, I think we're up to 19 SWAT members at Manitou Springs Middle School, which is awesome. When I first took on this, got this grant, I'm like, how am I going to get these kids interested? And the health teachers talk about vape and things like that, so they started with this young group here, and it's amazing. We've gone from 5 members to 19. I'll have you guys introduce yourselves.
Good morning. My name is Cade Cunningham, and I'm in the 7th grade, and I the MSMS SWAT team.
Hi, I'm Ezra Rasmussen, and I'm also in 7th grade for Manitou Springs Middle School.
My name's Catherine Hanchey, and I'm also in the 7th grade for the Manitou Springs SWAT team.
I'm Emma Wall, and I go to Manitou Springs, and I'm also in 7th grade.
We are going to have Miss Ezra and Katie come on up and talk about the signage that we did.
So we looked around the school to see if they had like tobacco-free signs and stuff, and so I looked on the buses and there weren't any, so we made sure that we added some.
I checked all the signs in the Silk building, which is just like a building we have for extracurricular, not core classes. There were a few, but a lot of them had like graffiti and stuff on them because, I don't know, teens are creatures of destruction. So we replaced all those signs.
And then all the SWAT team kids made sure to make signs and posters and stuff to put around the school. And we got some posters and we put them in the bathroom stalls and all of that so that people can be informed about how tobacco is not good for you and stuff and the effects that it has on you.
And I was impressed with the SWAT team in the boys' room, the bathroom. That's where all our vaping's happening, most of it. And so I went in the boys' bathroom one time after it was cleared out, of course. And one of the pamphlets, we had gotten pamphlets and some of our posters, and I believe it was Cade, because he's the tallest one on our team, put it way up top where the ceilings are, because they were hiding their vapes up in the ceiling. So I thought, A, they put it up there so it wouldn't get destroyed, but also to send the message when the kids were standing on the urinals to put their vape pens up, they'd see the message about don't vape and the harms of vaping and things like that. Dave, go ahead. Talk about what we did in the meeting.
Yeah.
So what we did in the meetings for our after school on Wednesdays, what we would do is that we would get educated on how tobacco use and vape use and other drug uses for children can affect you later on. And we also, like we said in a little bit ago, that we have been making posters to put around the school since most of our school unfortunately does vape and stuff like that. And we went online and we were learning about how most companies can target children in order to, because they're an easy target to present and to give out vapes and tobacco uses in vapes and especially weed. And so we learned about that, and now we're trying to slow that down in our school.
The videos next. Okay. Okay, we had a video to show you guys that our communication specialist put together to show you some of the activities when the kids were doing the bingo games and the word searches, making posters and whatnot. We'll go ahead and go to the next slide. I had the fun part, like you guys do, of updating policies and procedures. What we learned, Lene and them gave us a great resource as far as how we should present information on our policies. Our policies were very outdated. We even got challenged by some parents when we caught kids vaping. They're saying, well, it only talks about tobacco and cigarettes, not actually vape. So the principals and I are in the process. In June, we're going to finalize all our policies on tobacco-related stuff. They have not been updated in a long time, so I was glad to see that. I mean, it's important that we have good policies and to include all of the second chance programs and the alternatives, because if we send them home, they're just going to go home and vape. So that's been a really important piece of information for us to get and communicate that with our families. We've also given the kids that do get caught vaping, we do have them do the second chance program. Unfortunately, we've only had one so far that's had to go through it twice, but he finished the program again, and Lene and them came out on one of our Mustang Strong Day, and they did a presentation on tobacco use and vaping, and that same student that had to go through it twice, he actually volunteered to sign up for that one at the high school, so I was really happy about that. And through our morning announcements, we talk about My Life, My Quit. We talk about chewing tobacco, the dangers of that. We talk about how tobacco companies and all that kind of stuff. So on Wednesdays and Fridays, the students actually come and do morning announcements and just give 4 or 5 tidbits of facts about that so the students are educated about it. Emma.
So we have a success story in our school that we like to share, and it's of like one of the students' favorite teachers. His name is Mr. Bethke, and I went up to him during like 5th period, and I was like, I'm so proud of SWAT. We got a teacher to stop smoking, and he was like, that was me. And he told me all about it, and he was smoking, and it was really bad for him, and he didn't like it, and he wanted to quit, but he couldn't. And then as Cade and Katie and Ezra said, we were putting up posters in the bathrooms all around the high school, the silk, everywhere, like the buses. And he kept on seeing them, and he'd read them and see all the bad things and the cigarettes and the vapes and all that. And he eventually got to quit.
Very good.
We provided this presentation before we did our last Takedown Tobacco Thursday Day, and the kids really wanted to smash all the vapes that I've collected, but then they were reminded about the chemicals that are in the vapes and that hazardous material. So it was their idea to come up with having piñatas simulated looking like cigarettes, skull, and a vape, and then they wanted to fill it with flavored candies such as Jolly Ranchers and other things like that. So at our Tobacco Takedown Day, Lene brought those beautiful lungs that were talked about earlier, and it was good to see the ones that I know that are vaping kind of like would come up and they'd like 2 times kind of come up and feel them again and kind of have an impact on it. but also the students that pledged to not vape, use tobacco, or nicotine products, they got a ticket that said no vape on it, and then they were able to smack the tobacco or the piñata. And so it was kind of a cool event. The kids really enjoyed it. So we're hoping they're going to be our 8th graders next year, so they'll be the leaders of the school. So I'm really excited of what's to come. Thank you for having us here, too.
Thank you.
General Briggs.
I don't want to escalate this too much, but I would say, so I run the homeless shelter in Colorado Springs, the low barrier shelter, and we deal with addicted individuals all the time. And anecdotally, and I understand for all the scientists out there the difference between correlation and causation, I do. But anecdotally, I would say probably 100% of our heroin and meth addicts started kind of around middle school smoking. That was their sort of starting place, because then it goes to smoking something different, then it goes to the next maybe gateway drug, which goes to, so the real true gateway drug here is that smoking to begin with. Now, does that mean that somebody smokes is going to end up doing heroin? I'm not saying that. I'm just saying if you're doing heroin, you probably started smoking, is really what it is.
Yeah, so I'd just like to thank them for joining us today. That's 2 of our middle schools, and I've had the pleasure of working with 12 of them this year. And I'm looking forward to being in the schools again next year and making an impact on the youth's lives and helping them make healthy choices. Thank you.
Thank you. Wow, that was great. I want to thank all of the middle schoolers that showed up today. It is intimidating coming up and talking to a bunch of old folks sitting around here, but every one of us, I think, on this board has raised creatures of destruction ourselves. We appreciate the work that you're doing and being really a light in your own community and among your peers. That's not easy to do, but you're making a difference. And if you change one person, just like that teacher, if you change one of your fellow students, their trajectory, you've made a huge difference in our world, and we appreciate you. Okay, we've had 4 presentations on ongoing or renewed grants, and we do need to vote on these to accept these renewed grants. So we'll need a motion and a second.
Do we have to vote on them individually, or are they a block?
We can do them as a block.
Okay. I would propose that we vote on all 4 of these measures. They need to be read in any way? Okay. That were presented, as presented.
If you could move to approve.
Okay, good.
That'd be
I would move to approve the 4 grants that are, have just been presented.
Second.
And we have a second by Dr. Terbush. The motion is from General Briggs. All in favor of accepting these 4 ongoing grants, let it be known by saying aye.
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 Any opposed? And we hear no opposed. Again, thank you for all the presentations. That was very informative. We appreciate it, and we appreciate all of the work that's being done throughout El Paso County by everybody who presented this morning. Now, our director's report.
Well, I'm going to ask Samantha if the audio is working on Teams. We're going to back up and go to
Financial report.
the financial report. Is audio working? Or should we move on?
Just trying to get to the back room now.
Okay, so Samantha, she's on Teams.
If you can, yeah, that would be helpful.
Hey, good morning. Sorry about that, guys. So this is your April revenue or your April overall budget and actuals year to date. Overall, we're currently seeing our revenues coming in a little bit higher than originally anticipated. A lot of that is due to the ARPA that we had discussed earlier in prior months. We're starting to spend that down, so that number is starting to slowly come down. We are doing some underspending in the ELC grant, and a lot of that is due to some vacancies and a little bit of operating expenditures that just haven't come in. So a little bit of timing and a little bit of vacancies as well. But like I said, overall revenues are coming in higher than originally anticipated. For expenditures, they are coming in below expectations. And a lot of that, again, is to vacancy savings. But as we've heard with some of the other programs, it's starting to get positions filled. So we do anticipate that to start shrinking here in the next few months. And then operating is showing under budget, and a lot of that is just kind of due to some timing. So we don't anticipate that to continue on throughout the year. But overall, we anticipated we're doing better than we originally budgeted, and budget does not have any concerns at this time. Do you guys have any questions for me?
Any board questions?
I think it looks good. Thank you.
Okay. Commissioner Bremner? No? Okay, well, thank you, Samantha. We appreciate that.
Thank you.
Thank you, Vicki. We don't have to vote on that. Okay, now we are jumping back forward again, and we'll be at the director's report.
Okay. Thank you to our guests who are patiently waiting. I have one more item before we jump into a presentation. I'd like to introduce our new Strategic Initiatives Officer, if she is back there, Emily Maney. And she is an internal promotion. She served as a program manager with our maternal child health program, as well as helping to oversee the community health promotion division. And I wanted to give her an opportunity to introduce herself. The topic that we are going to present on with our community partners is suicide prevention and also the child vitality review team. And this falls under her scope of response, actually with the community health promotion division, but Strategic Initiatives plays a key role in that with behavioral health planner and such. So Emily, if you could say a few words.
Sure. Yeah. Good morning. My name is Emily Maney. As Susan said, I was the maternal and child health program manager here for 4 years. And I'm just really looking forward to moving into this new role and serving the agency in a different capacity. I do have my background in behavioral health. I'm a licensed clinical social worker. And so I'm just really looking forward to this new role.
Great.
Thank you, Emily. Welcome.
Thank you.
And now we have a presentation that was requested previously by Mr. Donaldson and gained a lot of interest from all board members on the topic of suicide prevention and status action that Board of Health can take. And so we have a presentation that includes our county partner, and Pete Carey was going to be here with us. He is the former Colorado Springs police chief. I think that he retired after 30 years. Youth is a passion to him, and he now serves as the director of El Paso County Justice Services Department. And I work with him on the county strategic plan, which our agency ties into, and its objective 4, health and safety. And if you can go to the first slide, please, where it says objective health and safety, please. Pete had a family emergency, so he couldn't join us today, but I'm sure that we'll see him at a future Board of Health meeting, as this is an ongoing topic and effort. The county's objective 4, health and safety, focuses on fostering partnerships to support community efforts to improve health and safety. And one of the areas of focus is suicide and suicide prevention. And I wanted to make note of that because we are in the process of developing our new 5-year strategic plan, and we stay closely aligned to county and also integrate our efforts. We have our youth resilience and suicide prevention planner with us, and to start off on teen suicide prevention, Brittany Rifle, if you want to come up. And then we also have the executive director of the Pikes Peak Suicide Prevention, organization. And then we also have representatives from our coroner's office, our coroner, Dr. Leon Kelly, as well as Dr. Emily Russell Kinsley, who is the Deputy Chief Medical Examiner. And so we will run through a few different slides, and I think you'll appreciate the presentation because it is very thorough. It has a lot of data in it, and I think one of the most important questions that was asked last time is, what can the Board of Health do?
Good morning. So great to see many of you again. I know I see some of you at community events, so great to be in front of you today. Before we start talking about suicide prevention, the data, and some of the strategies that are currently happening, I just would like to take a pause and acknowledge the lives of those in our community that have been lost to suicide. We know that these deaths impact families, community members, and those who are diligently working in this space. And I know that there are people in this room today who have personally lost someone to suicide. So as we work to address this really complex issue, I just wanted to acknowledge our suicide loss survivors and those living with mental illness. So I'm here to talk about our youth suicide, and I'm going to start by sharing a little bit of updated data. And in order to do that, can you go back to the previous slide? Thank you. So as we begin to talk about youth data, one of the things that will really help set the stage is briefly talking about our child fatality prevention system. So this is a system that is a legislatively mandated statewide group who reviews preventable child deaths from the age of 0 to 17. We started ours in our county in 2014 with a wonderful collaboration with our coroner's office, who you will hear from shortly, as well as the public health department. And really what this review team does is they look at what are preventable deaths that we are experiencing amongst our children. What are some life stressors is what we talk about. So what are things happening in the lives of these children and families? And what prevention recommendations, what are we seeing, and how can we support community efforts on this topic? So with that said, this group really has formed the Youth Suicide Prevention Work Group and a lot of public health's role in suicide prevention. We also take what is discovered in this fatality review team, and we share it with other local partners that are doing prevention work. So I'll talk more about that probably next month because we're up for a contract renewal from that, but just wanted to set the stage so we know where some of this data is coming from. Next slide, there we go. So this is our youth suicide data, and this is for children ages 10 to 17. So you'll see on the slide in the orange is our rate per 100,000, and the blue is our count. So you'll see that in 2021 and 2022, we lost 4 youth to suicide. The interesting thing that I will point out about this data point is you see a slight adjustment in the rate, and that's because we actually had about 1,000 less youth in the 5 to 17 age range in our community in 2022. So the rate is 3.2 versus the 3.1. So that's where we are related to the count and rate. And then if we'll go to the next slide. So in my work specifically, and as we talk about youth, we often talk about 18-year-olds as well because they're still in high school or transitioning from high school. And so even though we don't formally review their deaths through the child fatality review team, I do like to include them in the conversation as well. And so you'll see on these slides our count rate for our 10 to 18-year-olds. So there is a little bit of a difference. So in 2021, you'll see that there was 4 in the 10 to 17 category, and it bumped up to 8 when we added our 18-year-olds. And then also in 2022, you'll see that number bumped to 7, which was 4. And then also the other graph shows our rate compared to both the state of Colorado and national numbers. We are still waiting for our 2022 state numbers, and then also our national numbers are a little bit lagged as well, but that's remaining pretty steady for a national level. Another data point I would like to share is on our next slide, and this is going to be, we're now back to our 10 to 17 age range, and so the count for our death by suicide is 82 youth from 2015 to 2022, so that's what we're looking at. And you'll notice that 69% were male and 31% were female, and that's about in line with the state where we had 33% female and the opposite of that, 67% male. I can do math. And so that's where we have our breakdown for males versus females. And then on the next slide, which I wanted to share with you all, and this is death by suicides based on means. So we have 3 categories on this slide. We have 49% of our youth died by firearm, 41% died by asphyxia, and 10% died by what we've encompassed in an other category. So that includes poisoning, intentional overdose, falls, or crushes, and we've combined them together. So one of the things I want to say, as we were reviewing our 2021 and 2022 cases, some of the common factors that we saw as life stressors, as we've identified them, were, I'm going to pull this up so I say it correctly. There we go. Were parental divorce and separation, isolation, family discord, and a previous breakup or a recent breakup. And so those are some of the common factors we had seen amongst our youth as it related to that. So before we jump into prevention, I just wanted to pause and see if Director Whelan had anything she wanted to add before we move into, okay, wonderful.
Oh, yeah. Question. Thank you for your presentation. What about, do you have any data on attempted suicides?
That I don't currently have tracked, but that's definitely a number that I can pull up for you. It's a little bit harder because we have to pull that from hospitals and stuff as well. And so that's a number that I can get for you. I don't have that off the top of my head.
Okay, thank you.
Yeah.
Mr. Chair, can I ask a question? Brittany, you know, the data that we're seeing is for age range 10 to 17 or 18. Are the suicide, these are successful suicides, are they heavily skewed like above 14? That if, you know, we look at the 16 that happened in a year, 15 of them happened from 15 to 18?
Most of them are 5 to 17 in that age range. But we are seeing younger middle school students as well. So I can say in between 2021 and 2022, so that's 8, I believe half of them are in high school and half of them are in middle school.
Wow.
Okay. You don't have a slide like that, though, that shows the actual ages of the
no, but that's
suicide?
something I can definitely get
Okay.
to you.
All
And
right.
then we'll be talking about, Dr. Kelly in the coroner's office will be talking about some of the adult numbers as well.
Okay. And then is there a difference in suspected motivation among the younger kids versus the, you know, the 17-year-olds?
A lot of them all come back to that parental having challenges in the home with parental divorce or separation, isolation, and those types of things.
Okay, thanks.
Yeah. Okay. So a lot of these numbers can be really sad and hard to process. And so I also get to share some of the really cool community-based work that we do in suicide prevention. And this is really what I love doing. And so we have our youth suicide prevention work group. And this was started back in 2016 and was really just is a wonderful collaborative group of stakeholders from law enforcement, from hospitals, from behavioral health entities, faith community leaders, school support systems, youth serving organizations, and you'll hear from some of our community partners in a moment, and really all coming together of what can we do on a community level to reduce youth suicide. And so it's such a wonderful joy and privilege to see all of that. Last year we had a really cool opportunity where our group was like, okay, we've done a lot of the things that we set out to do, what's next? And so we worked through a strategic planning process where we brought in 5 youth voices, actually from an existing youth board through Pikes Peak Suicide Prevention, who we'll be sharing shortly, and 5 of our work group members. And they really processed like, where do we want to go with this? We are seeing some successes, and what's next? And so the vision and mission statement that you see on here was co-drafted from the youth and work group members. And really behind that was how are youth being prepared, empowered, and supported to thrive in this community? And so we've really shifted our focus into what you'll see: connection, awareness, resources, and education. So spell out the word care because we like to keep things really simple and easy to understand and remember. And so this work group is really centered around how do we care for our youth. And so there's some really, really great things that are happening in that space, which is very exciting to see. And then on the next slide, so that's a big, broad community, what are we doing on the coalition level? And then I put together some things that we as community members and we as board members and just us as concerned citizens can do to support our youth. One is build connections with one another. So our work group has been really focusing on increasing connections. So we saw isolation was a concern. How do we combat isolation? Through building connection. And it's a suicide prevention strategy, developing a sense of belonging in a community. And so what can the community do? We can start building connections with one another and being really engaged. Another thing, you've heard this said a lot throughout the day, was having a positive adult in a youth's life. Oftentimes it is the parent, but it also can be family members, teachers, coaches, faith community leaders, really connecting with that. Another thing that we can all do is learn how to have helpful language when we talk about mental illness or suicide. So an example of that would be when we're talking about a death of suicide, we say death or died by. Formerly, we would say completed or committed. When you hear committed, what do you think of? Committed a crime or a robbery. When we say completed, we think of, oh, we checked something off the list. So how we talk about it and saying a death or died by suicide is a helpful way that we can bring dignity to families and to youth who might be navigating that. Another thing is living with a mental illness. Instead of saying, oh, I have a depressed friend, or oh, my friend's anxious, we're saying they're living with this diagnosis, which can be really complex and difficult. A couple other things I'll review is one is just to share our own mental health journey. So as we talk about this more, we reduce the stigma that's often connected to our own, to mental illness and to suicide. Attending a suicide prevention training. We have some amazing trainings in this community that equip adults who are working with youth and also adults who work with adults to talk about suicide. How can we recognize signs? What can we do? What are the resources available? Knowing our local resources has been a huge thing that we can do. And then also safe storage of firearms and medications, which we'll talk about in just a minute. So that's kind of really what the community can do. So just wanted to pause before we bring up Cass Walton from Pikes Peak Suicide Prevention, see if there's any questions.
Go ahead, Dr. View.
Thank you, Brittany, for the presentation. Just two questions. Of all the methods of prevention, which methods do you think might be more helpful? And also, you mentioned about having adults in their lives that may decrease the risk of suicide. Can you give data on that, please?
So the first question was, which can be the most successful or most supportive prevention strategies? Really, it's touch points of each one. So each student might need something different. And really, this is such a complex issue. And so I don't know if I could identify the most helpful or successful strategy, but really it's peppering these strategies throughout our community. And then the second one about trusted adults. Research shows, there's actually an article from Princeton University, which I can get to you, and it talks about how formerly it was each youth needed one trusted adult in their life to be a successful human. Research is now showing that it's 5. And what that shows is that I need support from people, and maybe it's my mom at one point, but maybe my mom's at work and busy, so who else can I call if I'm struggling? Maybe it's my teacher, maybe it's a mentor. And so really it's just, how do we increase the number of adults? And I like to use it like a net. We're just building a stronger net of support for our youth.
Thank you. Would you be able to forward that source for me?
Yeah, absolutely.
Go ahead.
I would just like to make a comment that follows on that. So recently in the legislature, they passed a mental health survey bill, and there was a lot of going back and forth about that, even discussed here in this environment. And I would just emphasize once again that when we talk about trusted adults, it is a network. And anytime we undermine the idea of the role of a parent in that conversation, there should be some really good reasons why we don't do that. And so I continue to advocate that it is a network. When we see trusted adults maybe in the community that identify something, bringing the parents in who are going to have to live with this over time, should be a very important thing. Thank you.
Thank you, General Briggs.
Can I ask a question? So do you think that, I'll just say, because I don't really know how to phrase this, social media impacts, there's probably some dark sites, I don't know, I'm guessing, or has an impact on attempted suicide or suicides?
Yeah, I think social media is very complex, and I think it has a both positive and negative impact. I will say that through the use of social media, we've also been able, anecdotally, for youth to be intercepted prior to dying by suicide. So it's both. It builds connection, and then also can be a place of bullying. And so it's a really complex thing. And so how we like to talk about it in suicide prevention is what are our healthy strategies of using social media? Yeah, absolutely. Okay.
You've mentioned several times about it being a complex issue, and we understand that it is. I'd heard, I think this is back when I was a youth, about engagement and how important that is, and a lot was talked about sports and youth sports, being engaged with teams and things. Do you see a difference there? Does that help?
Yeah, absolutely. So that's what we would call a protective factor. So we have students who are at risk, and how do we combat risk by increasing protective factors? So being involved in sports or extracurricular activities, absolutely. Being connected to an adult is a protective factor. Being connected to your community and volunteering is a protective factor. Right. Absolutely. Yeah.
Thank you.
Absolutely. Right. So do we want to bring up Cass next?
Yes.
Wonderful. So Cass Walton, who is the Executive Director of Pikes Peak Suicide Prevention, I've mentioned her organization several times. She's really integral into this community, and she's going to come share about some safe firearm storage and other things this morning with y'all.
Clearly, we have to lower this mic. Good morning, everyone. I'm very grateful to be here. Still in an awkward angle. Okay. And so my goal here today is to talk to you about one very specific strategy that I hope that you will take into consideration and partner with us in the suicide prevention space to help spread awareness about this topic. And I'm going to hand some packets, if you'll take one and pass them around. My goal in giving you this packet is that you'll think about these words after this meeting today, and that you'll share it with someone else. And so one of the workshops that we're currently doing is called Safe Homes, Safer Families. And that's the idea that if we can create a safe environment, that our families will just be, in general, safer. And I think that that is something that we can all agree upon. May I have the next slide, please? So there are a few things about firearms and suicide that I would like you to know if you don't already, and I think Dr. Kelly will be able to speak on this with specific statistics to our county, but more residents die in El Paso County by suicide involving a firearm than by homicide and motor vehicle accidents combined. Youth who die by suicide with a firearm are most often accessing the household firearm to do so. So they're not going and getting a gun off the street or anything like that. They're taking the firearm from their home, usually the one that belongs to their folks. The firearm is the most lethal means that one can access to die by suicide. And so the idea of safe storage is this idea of creating a pause, right? So when you envision someone who is in that situation, and so what the average, if I could create a picture for you, the average person who may be contemplating suicide is probably an adult male who's in a situational crisis. That could be maybe today they lost their job, maybe they're going through a divorce, maybe something's going on with their kid that they're feeling some guilt and shame about. So they're thinking about that. They're feeling a little trapped. They're feeling a little bit like they don't know what to do, or maybe everything that they're trying is not working, so they're feeling some failure. And then because, they're not really accessing any other supports, maybe they decide to have 1 or 10 drinks that night. And they start to really get into that situation of, there's no hope. There's nothing I can do. And so imagine that this individual is in a home where that firearm is just readily available. And they start to have those thoughts of suicide. The thought of, I don't belong here. There's nothing left for me here to do. I want to die. And so you take that situational crisis, you take those 10 drinks, and you take that readily accessible firearm, and you have a pretty lethal situation. Change that scenario just a bit, and maybe that same situation is happening, but when he goes to access that firearm, it's locked up. And so there's a pause. And that's what safe storage does. It creates a pause, because what we know is that if in that moment, maybe in that moment, I'm trying to get into my safe or I'm trying to access it, someone walks in the room and they're like, hey, what's going on? There's a pause there. And that is the most effective time to intervene. And what we know is if I can stop you and say, hey, let's talk about it. A few things are going to happen within that pause. I'm going to sober up. My adrenaline is going to reduce, so my rational thought is going to return, and I'm going to feel connected to the person who I'm talking to. And that was all available to me because the firearm was not. And so that is what we are saying when we are talking about safe storage. We are trying to create a pause. Next slide, please. So the words that we are using to try and promote this idea with our community is, with ownership comes responsibility. And the idea behind that is that we are in no way talking about ownership at all. We understand that this is a firearm-friendly community, and that's great. There are a lot of really fun recreational activities that are done with firearms. We understand that individuals want the right to protect their homes, and we are in favor of all of that. I want you to think about all of the things that you do to create safety in your homes, especially when you have a kid in your home. We put those little things and the plugs, the things on the cabinets. I went to my friend's house the other day. They have a toddler, and I could barely open the toilet because there was this contraption on it. And that was because they were like, I don't want my toddler to drown in the toilet. And I thought, do toddlers drown in the toilet? What I know for a fact is that half of the suicides that occurred with our young people last year happened with firearms. And so if we're willing to put a plug into the wall and lock up our toilets, why not our guns? A few of the things that we are doing already to engage in strategies to promote safe storage include the Colorado Gun Shop Project. So Pikes Peak Suicide Prevention Partnership is contracted through the State Office of Suicide Prevention to pass out awareness and do outreach with our firearm retailers, asking them, so if you look in the packets that I gave you, you'll see a small sheet with Pete Leiser's face on there and his son. And that outlines for you what retailers are asked to do. They're asked to post signage in their stores that just promote or create awareness around the idea of safe storage. And they're asked to consider handing out some of that stuff with purchase, right? So if I'm going to, if you're going to purchase bullets for me, then I'm also going to give you a safe storage piece of paper for you to think about. And think about maybe putting those bullets away from the firearm and the different strategies for safe storage. And with that, we also just try and go to community events, and a lot of the samplings of the papers that I gave you are the outreach materials that we hand out, and then we just like to set these out in places. So I like to take them to baseball games and PTA meetings. You know, other resource tables have fun things like candy, sunglasses. I put these out. And moms will come up and say, is that a bike lock? And what I like about that is that it starts a conversation, because I can say, no, actually that's a cable lock for a firearm. And here's why you need one in your household. And then with the Suicide Prevention Collaborative of El Paso County and some students from Colorado College, we actually had 2 students from Colorado College contact us at the collaborative. And they said, we're really worried about firearms and suicide. And so they went and got a grant. They developed a workshop. It's called the Safe Homes, Safer Families Workshop. And what it does is it creates an opportunity for individuals to learn a little bit about basic suicide prevention. So what are the warning signs? Be introduced to their different safe storage options, because I think, you know, when some people think about safe storage, they think about those big safes that take a really long time to get into, that are usually like in the basement den. That's where my dad's was anyways. And so there are actually a lot of different strategies for safe storage, including, keeping your ammunition safe, separate from your firearm. There are quick release options. And so we just review those with firearm owners because we want to dispel barriers and help work through those things to what are some viable options to create safety in your home. We have a law enforcement person there so that they can dispel some of the myths around using temporary storage. So if, when we think about safe storage, when I want to talk with you about it is not when you've had those 10 drinks and you're in that situational crisis, right? No, but if I know that maybe my brother, who is going through a divorce and experiencing some financial stressors, and we're talking, and he's letting me know that he's in a bad space, before he's really to that height of his crisis, as someone who's informed, I might initiate a hard conversation that might sound like, man, you seem like you're in a really tough place, and I know that you have a lot of firearms in your home. I would love to store those for you for a period of time while you're working through this hard issue, just to make sure, just to be safe. And so the workshop talks about that and gives opportunities for what happens if I don't feel comfortable doing that and I want to use temporary storage. What does a red flag mean, and all those different things, because I don't know all the answers to those questions, but I know if someone's engaging in that conversation, I want them to be able to have that information. Next slide, please. So here's what I would like from you. I would like for each of you to consider in your packets, you have a flyer that says, serve as a host. So the model that we're currently using for this firearm workshop is like the Tupperware party model. So what we would ask is that someone who is a trusted messenger, because if I just walk over to a gun range, like imagine me right now in this outfit, going to a gun range and trying to hang out with those guys, that's not going to work out. But if someone who looks like them and talks like them and engages in the same activities as them says, hey, come over to my house or come to this place for dinner, and let's, I have a presentation that you can all sit through. And if you come, just like at the Tupperware party, you can get free products. You'll get placed into a drawing to win some things. You can win a firearm safe. There's a $100 gift card. I know that because some of you are elected officials, I can't give you a $100 gift card to host a party, but you could put that into the drawing for your participants and just give us the opportunity to get in front of as many firearm owners as possible. Because unfortunately, suicide for many is something that happens in other people's households. And I know that some of you are elected officials, and I invite you to ask the question, not today because I'm sure he doesn't have that data, but I know it's available to him. Is my district impacted by suicide? And I promise you the answer is yes. There is not a zip code in our city who's not being impacted by this issue. And so my ask for each of you is please consider hosting one of these workshops. Please consider being an advocate out loud for safe storage. If the cool kids are doing it, maybe everyone else will. And if you haven't already, just take a suicide prevention training. Understanding the warning signs really helps us to understand who could be at risk for suicide, and it could really be anyone. But there's this thing, it doesn't matter if I know how to identify it if I don't know what to do next. And so we want as many people as possible to be looking through a lens of prevention, which they can do if they go through a basic training, which is available in that workshop that I'm asking each of you to consider hosting. And then what to do and what are the resources. And as Brittany talked about earlier, all of that is available. We have these great succinct trainings. We have a ton of great trainers, and it's all available for free. We just need folks to invest their time so that we can save lives together. And that's my ask for each of you today. What questions do you have for me?
Any questions? Go ahead.
Can I ask a question real quick? Thank you, Cassandra. And without any judgment, I really don't know anything about guns or firearms. But many years ago when I was in medical school, I was told that, if you have a gun in your house, then your chance of being injured by gunshot is higher than if you didn't have a gun in your house. Can I ask you, was that true many years ago, and is that still true now?
The interpersonal theory of suicide has three components. So perceived burdensomeness, thwarted belongingness, and capacity for suicide. As soon as you have a gun in your home, you have that third factor in place. Your capacity for suicide is increased.
Yeah, thank you for your presentation, Cassandra. And I think, like for me and many folks who kind of think the way I do, you have lots of support on programs to help people learn about signs of someone who's maybe struggling and could be considering suicide. And as a former PA, I used to ask those questions and direct them immediately to help. But as far as legislating, which they tried to do last year, separate, everyone has to lock your firearm in a safe, or separating the magazine from the weapon. A lot of people use firearms for home defense, and they're used successfully, I'd say every single day in the United States. They're successfully used for that reason and for that purpose. And it becomes just impractical to go one place and get your the bullets or the magazine, go another place and get your weapon. Because when someone's breaking into your house or there's something going on, that's when you panic, and it's very hard to do anything. And so the more barriers you have to successfully defending yourself, it becomes ineffective. And so I think that's the catch, or to have a chain through the weapon. Some of the things where you can lay a finger on it and it opens up, maybe. But again, when things go crazy, it's very hard to operate these different mechanisms and put the weapon back together and use it, because you'll be panicked anyway. So just wanted to say that I know you've heard that probably many times, right?
Absolutely. I am a fan of home defense. I am a proponent for self-protection. I think that that's all very important. I think that Dr. Kelly will be able to back me up here, but I think the likelihood of being in a in-home invasion situation versus having someone in your home who's having thoughts of suicide, the likelihood for the thoughts of suicide is much higher than having to use your firearm to protect yourself in your home. And that's why I would argue that engaging in purchasing one of the quick release options is in the best interest of your household and your community, and practicing with that. We know that fluency under times of stress, that's how we really train to keep ourselves safe. And so if you get a quick release, safe storage device, practice that with that, just the same way you would do a fire drill or anything else, then I think that you can feel comfortable and confident that you could, in an unlikely situation that you would need to, keep your household safe. But I just think it's, when we think about risk mitigation, we have to look at the reality of statistics and, what's happening more. And death by suicide with a firearm is happening much more often than someone having to use a firearm in their home for self-protection.
And we would have to see the actual data, and we'd have to really look at facts, not people's, I think this and I think that.
I'm definitely not saying that from an opinion. I wouldn't talk about that out loud if there was not data to back that up.
Yeah, and I don't want to go down the rabbit hole of statistics, but I can get the statistics on weapons used in home defense in the United States, and there's a lot. People don't realize how many times that happens. And another thing is, in England, they have a lot of daytime home invasions. I mean, that happens a lot more in England than it does in the United States. Why? Because the English don't have firearms in their homes. It's not allowed by the government. So criminals know that, and they just kick the door in and go in. In the United States, we don't have that very much because you get shot when you do that in the United States. A criminal can do that so many times he gets shot. I've talked to CSPD, and they've told me that they'll have a series of home break-ins, and then that guy will get shot, and that kind of calms down the criminal element for a while. So there is a real deterrent. And I look forward to talking to you in the future, but I just think it's important to have that other side put out there, that there's a reason people have firearms, and it is home defense oftentimes. And the barrier between my hand going on that gun and being able to do something, it's the whole thing about when seconds count, the police will be there in minutes. And so seconds count. And just personally, I had an uncle kill himself with a firearm. So it's not an abstract idea, it can't happen in my family. It did happen in my family. But there are other risks which, make you put it on the scale of, is this the right way to respond to this? In some households, perhaps it is. Like if you had a member of the house who's experiencing depression or something like that, maybe those things get weighed differently. So,
And I think that's some of the medium ground that I'm talking about here. Being able to identify our household is in a stressful situation. We do have a young person in our household, and we never know when our young people might be experiencing a stressor because it's so common. Because I don't know about the England statistics or what's happening across the country, but I know that I just 2 weeks ago sat with a family that during the day, because the firearm was unsecured and no one was home except for a young person and a firearm, that there was a loss of life. And so what I can say is that it may not be appropriate for everyone all the time. I agree with that, but there are definitely circumstances that require us to take a second look and consider what risks do we need to be looking at in our household specifically.
thank you.
Thank you for that, and thank you for those last comments. Dr. Vu?
Can I ask, Cassandra, would you be able to talk more about the source data for this slide?
Yeah, I actually, that's pulled from some of our, the Colorado Gun Shop materials. And so I just like to use that, that image that you're looking at from that slide. It's the one with like the bunch of colored people that was on that one.
Yes.
Just to show the risks that we're trying to talk about mitigating here and why.
And would you be able to forward those sources to us? Thank you.
So again, thank you. I appreciate that. And Councilman Donaldson, your comments as well. I think one of your previous slides had the heading on it, with ownership comes responsibility.
Yes.
And I think that kind of speaks to both of those conversations, that if you're going to own a firearm for whatever use you have it in your home, there's a responsibility that comes with that. And the safety of those in your home should be paramount. That's why you have it for home defense, but that's also why you need to be careful with it for those reasons, to prevent easy access for those who are in crisis.
Absolutely.
I appreciate it.
Yeah, and that's the thing. It's like you might do something differently during a time in your life when there are situational things going on, and that might change from time to time, but it's being aware of, it's just like weather stripping and things like that. When there are storms coming, we take preparation to keep our home safe, and that's the same when we have mental health challenges that are occurring.
Right. Provided, of course, we can see them coming. And so many times the family, there are remarks afterwards where they didn't see it coming. They weren't able to see the warning signs.
When I attend a funeral or sit in a bereavement meeting with individuals who have just lost a loved one, the most common thing that I hear is, we had no idea.
Right. Well, thank you again. I know we have a couple more presentations coming up. Any other questions for Cassandra?
Thank you.
Thank you.
I know we're getting on time, but I wanted to allow just a few minutes for our coroner's office to share some stats from 2022 as well as some predictions for 2023. So Dr. Emily Russell-Kinsley and Dr. Leanne Kelly are coming up next.
And thank you for your patience.
So we started today with some conversations about connection with kids, and I've been to enough of these to know it was going to run late. So I've got a middle school awards ceremony that I am late to, so I'm going to head that direction. But my Deputy Chief Medical Examiner, Dr. Russell Kinsley, is more than qualified to provide you all some information. But we also started, I think, with Chief Colas's comments of taking tours. And we talk about a lot of numbers at this meeting, but nothing will give gravity to some of the numbers that Dr. Russell Kinsley is going to talk about than a tour of the coroner's office. So I know several of you have been there. and I'd love to have the rest of you come by and see what we do and how we do it. So I'm also available for any questions later after if you need it. But thank you.
Thank you, Dr. Keller.
Hi. Thank you for having me and allowing me to present this important information to you. So in 2022, Dr. Kelly has been working on compiling all of the 2022 data regarding the deaths in our community. In 2022, we did see a 10% increase in suicide in all age ranges. This had been, the number was 194 in 2022. We had 176 in 2021, and the number had been pretty steady for several years. When we look at what's happening in these cases, in these situations, I want to draw our attention to the box 2022 suicide facts. Let's drop on down to the bottom. So in 2022, 74% of these individuals were male. That's a 7% reduction. In the past several years, we have seen about 80% male. So this increase, this 10% increase, is attributed to women. I think that's important for us to all note. The other thing that we can see is that last year, in 21, we had a jump to 30% that were active military or had prior service. And that went down to 25% last year. Things that were steady included the age. The average age was 44. That's been steady for several years. Our age range narrowed a little bit to 13 to 88. About a third of the people had social media posts regarding their suicidality, and that was steady as well. 55% in 2022 had a history of expressed suicidal thoughts. That had been in about the mid-60s previously, so that was a change last year. The presence of substances was also steady. 73% had substances present at autopsy, drugs at 42%, alcohol 36%, and THC at 22%. When we're looking at means, there was a slight increase in firearms, ligature, and falls. Firearms was the overwhelming majority of means, the blue area, followed by ligature, and then falls, which I mentioned had an increase, as the pale blue area. Someone had asked about risk factors, I believe, in adults versus kids, and those were steady as well in this population. Same thing, relationship, financial, legal, health issues, substance abuse, and grief. We are a decent way into 2023, and so what we're seeing so far as of the end of April is that the number of adults is pretty steady. Unfortunately, we do have an increase in our youth and teen population. And that's the conclusion of my presentation. Do you have any questions for me?
Go ahead.
Yeah, thank you for the presentation. And I had actually forgotten I had asked for this presentation until Susan mentioned it. But the reason I asked is we have a new member on City Council, David Lineweber, who's one of the new guys that got elected, and he has a real focus. This is his focus, his mental health. And there's been a couple suicides that he's been close to, and that's driven this. And he had said, a couple things about how in El Paso County we're doing a terrible job, and that we're really sort of in a bad place as far as suicide prevention and numbers of suicides. Can you address that, like compared to the rest of the state? How does our county look? Nationally, how does our county look? And are there some factors in El Paso County which make it unique? One of which, I read somewhere that even, I believe, altitude or elevation, there's at least a correlation with suicide numbers. cities or communities at higher elevation, like 6,000, 5,000 feet, have more suicides than lower. And just other things. The military population, we have younger, military or risk-seeking folks in general that a higher number of them go into the military. So the population in El Paso County is not the same as a rural county, even when you control for numbers, 1,000 citizens versus 1,000. So that was one hell of a long question, so please take a shot at it.
Sure, I'll try to touch on some of those things. My understanding is that nationally speaking, Colorado is, and if I am wrong, someone please jump in and correct me. My understanding is that Colorado, as a state, looking nationally, we don't do well. And El Paso County, within the state of Colorado, we don't do well. As far as particular characteristics about our community, was that correct, by the way? Okay, that's what I thought. As far as characteristics about our community, I don't know that it's my place to comment on that. I'm giving you the information that my office collects. As far as altitude and things like that, I've heard those things. I can't speak to that today, but the risk factors, we do a very thorough interview with survivors regarding what was going on in these individuals' lives, far beyond what is expected of us in order to complete our work. And so that is the information that we've been able to obtain.
May I say something as well to your comments or your questions? Commonly we focus on the problem and everything that's going wrong. And I feel really compelled, and I get passionate about this as well because Dr. Kelly and I are, back in '24, we're the ones that initiated the development of the youth focus, teen suicide prevention. And prior to getting funding in 2016, there was a big gap. And so I want to acknowledge all of the hard work and what is going well, because there are numerous organizations, numerous people with lived experiences that have lost a child or a loved one that are so engaged. And we would, exceed the capacity in this room, the number of people that are working on the efforts. And so I think it's important to also call out what is going well. And what I always say is to keep up the momentum. The county commissioners also, I went to them back in 2018 and asked for critical needs funding. They are funding teen suicide prevention. And so I think that there's an opportunity also to get more engaged. The funding from the State Health Department and the suicide prevention, the commission and such too. There's a lot of work that still needs to be done, but this work is so heavy. I would get so much anxiety or ill feelings when someone from a school was calling me or Dr. Kelly was calling me, because back in 2014 and 2015, we were experiencing just too many deaths, and one death is too many within youth. But it is heavy work, and the people that are involved in this work, I want to acknowledge them and lift them up, because this is something that is it is really difficult work. And so I feel compelled to say that, because I know we've got a lot of problems in our community. We talk about complex, homelessness and mental illness, but there's a lot of good people and organizations, including the Board of Health, that are engaged and interested. I don't want to lose sight of the good work that's happening and build that momentum.
My point really is in support of yours. I don't think it's as bad as some people think, and I think there's some differences in El Paso County which make El Paso County different than other locations, and that needs to be factored in also. Maybe I'll just send you an email, more like what my questions are, because this is great information, but that was kind of what I was looking for was to address my colleagues' concerns that we are, there's like this huge problem right now. When I'm here to listen, but I don't know that it is that bad in El Paso County. Obviously we certainly don't want to be higher than the mean on suicides, but again, I don't think it's as bad as some perceive it to be. Honestly think it's that bad. Maybe we can do some work to shed light on it and tell the truth.
And I appreciate that. And there are a lot of opportunities to connect with various organizations and experts to get unfiltered information. And that would be a call to action too, to really encourage, what can we do on the topic? Because if we don't keep up the momentum, and if we don't keep focus, and we don't keep the funding, and I call it like a full court press, we're going to see, increased problems. But I think that where we are, and it's not, every year is a little bit different, but I do believe that we're making progress, and I think that there are different, actions that folks, wherever they can tie in and support, and we've offered a lot of that here today. So where can people plug in to align and to help us keep up with the momentum?
Well, thank you very much. And again, Councilman Donaldson, I appreciate those questions, because if there is a difference in El Paso County, and if there is a difference in Colorado, if we can identify what is creating those differences, then we can maybe better address the issue and see these numbers go in the right direction, which is down, rather than to trend upward or to even stay the same is not a win when we're talking about suicide. So if we can learn anything from that, and if there's any information that any of the presenters can bring forward to us to help you, we would appreciate that, because we want to see the numbers go the same direction you want to see them. Be great if we could abolish these work groups, because there wasn't any work to do, but we're not there. And so everybody who's in this community is a part of the solution when it comes to something like suicide. Thank you.
Thank you, Dr. Russell.
Cass has one last comment in the work she does.
So one of the things that I wanted to comment on when you look here is when you saw Brittany's earlier slides, so there was a slide that showed that in 2021 or 2020, there were 16 youth suicides, and then it went down to 4, and then it sustained at 4, and now you see it at 5 for the start of this quarter. And so what I encourage all of us to do working in the space of suicide prevention is look at what's changed between last year and this year, and what are the strategies that we know are effective. I think that the number that we can really look at is what strategies did we use to get from 16 to 4, right? And can we use those strategies with adults? The answer is yes. And what's happening to impact those strategies now, which is an important conversation that needs to be had. So I think it would be a great thing for who's the council member that you were speaking of?
Lineweber.
Thank you. I didn't want to say his name wrong. But to just get educated around what is happening, and then figure out how we can really continue to focus on the effective strategies that we know do work. And it's not a ton of rocket science, but it's strategies that need to be consistently implemented, and like Susan was saying, the momentum maintained over time.
Well, also, if you look at your chart alone, in 2021, most of 2021 and 2022, our teenagers were home taking online classes. This year, they're all back in full load of AP classes, and the pressure's higher.
The pressure's higher, and things have changed for them, right? They going from home to school again, and what modifications were made. And also what I can say is that when they're home, who are they seeing a lot? Their parents, right? And during those 2 years, we saw like a 100% increase in the amount of parents who are being engaged in suicide prevention training.
I guess what I would like to know is thus far this year by 4:30, that's 5 teenagers, which equates to 1.25 per month for the first year. what were the numbers in 2019? Because 2020 to 2021, when our kids are home with us and they're not in a full load of AP classes, 6 AP classes, are these numbers this year the same as 2019? Because 2021, frankly, is skewed numbers.
I think I agree with you, and I think that also we could do a side-by-side comparison of the things that have changed, and it's a number of different components that have changed for our youth and for our communities, even just the climate of our community and the things that we're talking about.
We just wanted to wrap up and say thank you so much for your time. We're happy to continue this conversation and just know that there's, back to Director Whelan's point, there's so much amazing community collaboration that's happening that I think is really unique to El Paso County. To your point, Councilman Donaldson, is that our community wants to work together on things, and so I think that's really beautiful and why we're seeing some success with youth, and is also being incorporated into this suicide prevention collaborative that's also working as well, focusing on veterans, military members, middle-aged white men who are one of our top suicides, and so there's just, our community is wonderful and they're really working hard, and so thank you so much for your time and your interest in this, and we're happy to continue because I know we are well over time, so thank you, Ted.
Well, we really appreciate the work that's being done. Susan mentioned it earlier, one is too many, and I think we are all in agreement with that. If there's a way to get the numbers to go in the right direction, and if any of us in our various capacities are able to help with that, we certainly want to do so. So we appreciate the information. Thank you. That's it. Okay. That brings us to the end of our meeting. I will entertain a motion for dismissing this meeting of the Board of Health.
I move that we adjourn.
Okay.
Second.
And we have a second. General Briggs moved to adjourn, and Glant moved to second, and all in favor?
Aye.
Aye. All right, we'll see you all next month. Forgot that.
Hey, Susan, next month,